Are medications for weight loss like Ozempic safe? They might be dangerous if not used properly, yet they also offer great results. Let's examine how to take these drugs safely and steer clear of typical pitfalls. Loss medications such as Ozempic, Wegovy, and others have gained a lot of popularity. However, it's crucial to understand how to use them correctly before hopping on board. We'll go over important advice from professionals on how to look good and stay safe in this video. Now let's get started. Thinking about taking weight loss medications like Ozempic without contacting a doctor? Think again. First, main point. Seek medical advice first. Loss drugs such as Ozempic and Mounjaro should never be used without a doctor's supervision. A recent survey found that 25% of adults would consider using these medications without medical advice, putting themselves at danger. If medications are not taken correctly, they can produce serious adverse effects such as nausea, dehydration, and even gallbladder disease. Always contact with a specialist to ensure safe and effective use. Second main point, do not skip doses. One typical mistake is to skip dosages. GLP-1 drugs, unlike several other medications, must be taken exactly as prescribed. Missing doses can diminish the drug's effectiveness and prevent you from seeing the weight loss outcomes you desire. Set reminders, use medicine organizers, or do whatever is necessary to maintain consistency. The efficacy of these drugs is strongly dependent on following a good regimen. Main point. Give protein priority. Maintaining muscle mass is crucial when taking GLP-1 medications. These drugs give you a feeling of fullness, which frequently reduces appetite and can result in muscle loss. To maintain muscle mass while reducing fat, make sure you're receiving adequate protein, whether from lean meats, fish, eggs, or protein drinks. Main point. Remember, fiber is essential because these medications can make you constipated. Make sure your meals include foods high in fiber, such as leafy greens, beans, and lentils. These are a simple choice if you're not feeling very hungry. Main point. Continue exercising. Weight loss medications do not replace physical activity. Strength training is vital for keeping muscle and increasing metabolism. For the best results, don't skip the gym. Instead, focus on gaining muscle while losing fat. Next main point. Long-term commitment. These medicines are not a quick fix. Plan for the long term, as discontinuing them generally results in weight gain. Create good routines surrounding your nutrition, exercise, and mental health to get long-term effects. Seventh main point. Skip meals. If you are not hungry, you should not miss meals. To avoid dietary deficits and maintain a healthy metabolism, you must consume foods in a consistent, balanced manner. Smaller meals or protein smoothies are ideal for low appetite days. Weight loss medicines can be effective, but only when used properly. Consult your doctor, adhere to your program, eat protein and fiber, and continue to exercise for the greatest results. If this was helpful, please like and subscribe to receive more health and fitness ideas.